Coronavirus disease 2019 or COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. It was first tested in Wuhan, China in December 2019 and quickly spread worldwide through human contact and travel. COVID-19 spread mainly through respiratory droplets and contaminated surface. Symptoms include fever, dry cough, and loss of smell of taste with elderly individuals and those with health conditions at higher risk of serious complications. The pandemic affected not just the Ministry of Health (MH) but also agencies like the Royal Malaysia Police, Malaysian Armed Forces, and the National Security Council. To control the spread, the government introduced the Movement Control Order (MCO) and implement new norms, including strict SOPs. Hospitals were overwhelmed and healthcare workers worked tirelessly under immense pressure.
Let's start with what is actually planning. Planning is the most basic managerial function. When done properly, it sets direction for the organizing, leading, and controlling function. Planning divided into three sections, which are operational planning, strategic planning, and tactical planning. First of all, operational planning involves in directing the organization day-to-day short-term operation to achieve overall strategic objectives consistent with the organization mission and policies. Next, strategic planning is a long-term planning done by the top management to determine the overall organizational purpose and objective and how they are to be achieved. This can help to give a clear sense of where the organization is going and allows to ensure teams are working on projects that make the most impact. Apart from that, tactical planning is designed to implement all goals set in the strategic plan. It outlines action to achieve a strategic plan. It is a short-term planning for 1 to 2 years and must be updated continuously to meet current challenges.
Moving on, I want to talk about how is the government managing the issue of COVID-19. The short term, the government imposed movement control orders, which family known as MCOs and lockdowns. The government also expanded the number and ability of COVID-19 tests as well as contact tracing, not to forget about the launch of MySejahtera app for health monitoring, as well as thermal scanners installation at borders and designated 57 hospitals for screening, 38 for treatment. Meanwhile, for long term, the government introduces the Health White Paper for healthcare reform, as well as expanding digital health tools like electronic medical records and telemedicine. Not only that, but the surveillance system has also been strengthened for future outbreaks and prompted community-based health program for prevention.
I will continue this presentation with the definition of organizing. According to Ricky Whitgraffin, organizing is deciding how best to group organizational activities and results. Other definition lists that organizing is a recurring activity which must be done from time to time to balance the organization's need for both stability and change. Organizing is not only in profit-making organizational, but it also in non-profit-making organizational too, such as in university, hospital, football, and what's not. If we were to apply organizing properly, we can distribute workload to all organizational members to be able to move towards achieving the goals together. Then it can avoid duplication of work to minimize the cost. Lastly, it can ensure the use of organizational on resource efficiently. The real question is, how does the government and the ministries apply organizing during COVID-19?
During the COVID-19 pandemic, the Ministry of Health did a really good job organizing everything to handle the crisis. They set up a main center to coordinate all the work, team up with hospitals, other government agencies, and NGOs, and rolled out mass testing, contact tracing, and vaccinations. They kept the public updated with daily briefings and health tips, which really helped reduce confusion and misinformation. They also made sure things like ICU beds, PPE, and even food supplies were well managed. Plus, With the EMCO lockdowns, they control high-risk areas while making sure people got the help they needed. In short, the organized approach was key in protecting life and keeping the healthcare system from being overwhelmed.
A part of planning and organizing, we also have decision making. What is actually decision making? Decision making is the process through which manager and leader identify and resolve problem and capitalize on opportunity. This process can sometimes have a critical impact on personal and organization life. Others time, decisions are more routinely in its approach but still require the selection of an approved course of action. There are two types of decision making. One of them is programmed decision, and the other one is non-programmed decision. Decision making was applied in Malaysian COVID-19 by focus on early detection, including temperature check and rapid testing expansion. The government also used the MySejahtera apps for contact tracing and launched the movement control order to limit movement and gathering. For the preparation of the healthcare system, they increased ICU bed, ventilators, and built temporary hospital like MAPS Serdang. The National Immunisation Program was launched using MySejahtera to manage vaccination efficiently. Lastly, public communication was a priority with daily update and clear safety guidelines. Malaysia also worked with the WHO to secure vaccine and expert advice. Financial aid package and mental health support hotline were set up to help individual and business cope.
Before we end the presentation, we also have controlling. Controlling is the process acting to ensure desired results. The process of monitoring, comparing, and correcting work performance plays a crucial role for controlling. One of the importance of controlling can deal with change or essentially deal with complexity and can assist the management process. This process we are carried out by our government. The Ministry of Health made sure strategies were working and aligning with their public health goals using data, science, and expert advice to guide action. The Director General of Health led a clear structure and allowed for smooth communication and coordination with the National Security Council and other agencies. They closely monitored the movement control order, made sure the MySejahtera app was effectively used for contact tracing, and oversaw the vaccination rollout the right groups. Importantly, the ministry adapted its strategy when faced with changing data, public concern, and political issues. Overall, continuous monitoring and adjustment were key to achieve the desired outcomes. Thank you. That's all from me.
In conclusion, the COVID-19 pandemic was a major challenge for Malaysia, but the Ministry of Health MOH showed strong leadership and resilience. Through quick action like the movement control order, mass testing, contact tracking, and a well-organized vaccination program, MOH help protect public health and prevent the healthcare system from collapsing. Using a SWOT view, MOH strengths included its fast response and use of digital tools like sejahtera. While witness were shortage of supplies and the heaving burden on healthcare workers. The crisis also brought opportunities for improving digital health and interagency cooperation. Top challenges like viral mutation and misinformation remained. We recommend MOH continue improving healthcare access, mental health service, and public communication, strengthen future pandemic readiness. Overall, MOH handling of the crisis balance quick action, flexibility, and public involvement.